the policies which the national can bring about would go, it would not work. We would not see a new picture. We would not see reduction in maternal mortality under 5 mortality. We will not see reduction in deaths from epidemic and pandemic if the states are not strengthened. We have commissioners from the 36 states and the Health Secretary of Abuja present at this meeting and joining us from wherever they are. And we're all listening with our minds open. How can we work with the federal government to improve things in our states? How can we work with partners to improve things in our states? How can we change the rhetoric? How can we make Nigeria better, especially as it concerns the health sector? That's what we're here to discuss for the next 2 days. Of course, one of the very striking issues which we have been able to identify as commissioners for health in Nigeria is the fact that we have a lot of fragmentation from the national all the way down. And it's affecting the system because things are being duplicated, there's wastage, there's leakage, and there are issues with implementation. We want to be able to bring together or marry together all the various interests, at the same time decentralizing from the federal, which is the central, down to our states. Of course, this meeting would avail us that opportunity to understand the workings of our partners in the health sector and find a way to reach out to states that do not have partners working in them already. I'm sure you know that in some states, they have maybe just one partner or two, and other states have every single partner in Nigeria. How can we spread out to help other states? More importantly, the indices from our country is disturbing. The indices from Nigeria is disturbing, whether it's maternal mortality, under 5 mortality, tuberculosis, malaria, name it, no matter what it is, the indices are disturbing. And we need this picture to change. If we do things the same way, we cannot expect a different result. And that's why we're meeting. How can we work together with the federal government, the Federal Ministry of Health, all the parastatals and agencies under the Ministry of Health, the Presidential Task Force or the Presidential Steering Committee to change things at our state level. At this point, I want to very, very profusely commend the Presidential Steering Committee, which is to be the Presidential Task Force, for the excellent work they have done to really, really help Nigerians and really save Nigeria. The predictions were really very bad, but today we're sitting together in a room and everything is happening positive for us. This is a great one. We want to say thank you to the Chairman, Boss Mustafa. Thank you to the Honorable Minister for Health. Thank you to our dear Senator Mamara for all the efforts, and indeed every member of that team. We want to say thank you. We'll work closely with you to improve things. Again, we want to thank the Federal Ministry of Health for their leadership. We want to thank all the national partners, the national agencies and parastatals under the Federal Ministry of Health for their support to us at the state level. We are appreciative of all you're doing. We just want to say, let's do more and let's do it differently to see a better result. Our thanks will also go to members of the private sector that are well represented here today. We have the Dangote Foundation, we have Sterling Bank, and all the members of the private sector that are willing to work with the state governments to change things. We need more involvement of the private sector down at the state level. If you go back to history books, I'm sure you would recall that even nations like India and the rest of them that had the revolution in the medical world, the private sector had a key role to play. We want you to step up your game in supporting the health sector, both at the national and at the state level. We also commend you for the wonderful work you did during the onset of the COVID-19 pandemic. We had COVID, which was really private sector driven and supported states across Nigeria. We're very grateful. Finally, to our dear partners, it's time to do more for us. Our states require more of your support, more of the intervention in an integrated manner. The vertical programming and silos would lead to duplication, and it might not help build a more resilient health system. We're pleading that you work with the ministries of health at the federal and of course at the various state levels to provide integrated care so that we don't have overlaps and we don't have wastage. We are also pleading that you spread to other states where you presently are not working so you can support them. Remember, work in one state will not help us see the big picture in Nigeria. If we must get that big picture of having the change of all the indices that we're not comfortable with, then we need to have the spread, whether it's at the northern part of the country or in the southern part of the country. Finally, this is a call for all the commissioners for health in Nigeria for us to do more. We've been awesome. In the last 1 year, we've lost some of our members to COVID-19, we've lost some to other ill health, and I want to plead that we all stand and give us just 1 minute to remember all the commissioners for health that we have lost in the last 1 year. This is in respect of our dear colleagues that have gone.
Whenever I think about my personal involvement with most of us and with what is happening in the health sector in Nigeria, I think it's quite a privilege to me that I'm in a position to impact change and to affect the outcomes of our lives in the future. I usually tell people, I say, now I'm young and we are young. If we
feel something is changing in Nigeria, as has been mentioned, in the Nigerian health scene. Our indicators are not very good, and they will not be very good until we make a decision to move things forward and deliver where the care is needed. And that means primary health care. I think from UNICEF, this is the greatest contribution that we can make to the Nigerian health system, to build a strong primary health care, building from COVID, building on the leadership that you've shown over the last year. And we just stand here very much committed and ready to support everyone in this room in every aspect and every key role they have to play in making that a reality. Thank you.
And I hope that by speaking briefly, there's more chance that you'll remember what I've said. In the middle of a global pandemic, the like of which none of us have ever seen in our lifetime, in Africa's most populous country, and one of the most strongly federal countries in the world, this meeting could not be more important, because in so many respects, Nigeria's future is in the hands of the people who are in this room. But underpinning that importance is the fact that healthcare, with or without a pandemic, is incredibly important for the development of countries. Because what we've belatedly realised with all our economic modelling in the World Bank is that people are more important for economic development than any other ingredient of growth. And we talk about something called the demographic dividend, which is that, and you'll remember the gentleman from Sterling Bank talked about what happens when we get old and we need healthcare. What developed countries now realise is that looking after an increasingly elderly population becomes more and more expensive. And the country needs to have grown before it reaches that point to be able to afford to care for them. Nigeria is in that sweet spot, but the ability to realise the possibility of this demographic dividend, to use its young people to grow the economy before the population gets old, really rests on the services of health and education that allow them to realise their full potential through life. So we recognise that the Bank Nigeria's commitment to universal health care is incredibly important to that realisation of the potential of demographic dividend. But somebody's got to pay for that. And at the moment, Nigeria has one of the lowest rates of domestic revenue generation of any country in the world. So that means that the money to pay for that cannot all come from the country's budget, at least not until that rate of domestic revenue is lifted. So with that, I want to talk a little bit about how the bank is helping to support the country's health development at the moment. And we work very closely with all states through our REDISI and COVID preparation and response projects. We're also have approved through our board the Impact project, which is going to support the country with child survival through malaria and immunisation programs. And at the moment we're in discussions with the government about another project, $400 million, that will help the country to purchase vaccines. But I want to just say something about how the bank works. We're different from other donors. We are basically like the bank that lends you money to build a hospital or to build your house. Our success depends on government success. Our projects are implemented by government, and what we provide is the technical dialogue and support to help make those programs a success. But we really depend on all of you, all of the state health commissioners, to make those projects successful. And we also rely on the national federal level agencies, the Ministry of Health, the NPHCDA, the NCDC and so on, to show the leadership that can bring all of that effort together. And I believe that this meeting is incredibly important for achieving that objective. And Illumide has put me on the spot. I can tell I'm going to have a number of you asking me for money, so I'm going to turn that one back to you with a request. Currently we have a total of nearly $1 billion in financing for Nigeria's health sector, which has already been approved by the World Bank Board. That money will be able to start flowing to states once the National Assembly gives approval for the borrowing plan that those projects are within. So I'd encourage all of you to have a word with the Member of Parliament that represents your state and see if they can help you to fast track those so that we can unlock those resources and get that money flowing. With that, I'd like to say thanks very much. I wish you all the best for a very productive discussion over the next 2 days. And I look forward to connecting with many of you in the lunch break, and I hope that we'll be spending more time in each other's company in the future. Thank you very much.
Thank you so much, Kathy.
All of the health commissioners and the Health Commissioners Forum Secretariat for allowing the U.S. government to speak to you for a few minutes today. I've been really fortunate to have met and worked with many of you over the past 2 years, especially during our high-level advocacy visits during late 2019 on behalf of the United States government's flagship program that you know as PEPFAR, which stands for the U.S. President's Emergency Plan for AIDS Relief. It's our most successful health program ever. Since first arriving in Nigeria in the late 1990s, where I met Senator Mamora, health sector engagement has always been a top priority for me and something that I really feel truly passionate about. From those early days of the AIDS epidemic, when HIV was truly a death sentence, to now, I witnessed firsthand the transformation of how we treat and manage not only HIV, but other health threats in Nigeria. So HIV is no longer a death sentence, but a disease that can be treated and managed like other chronic diseases, such as heart disease and hypertension. Since 2004, the US government, through PEPFAR, has invested more than $6 billion in Nigeria. This includes support for facilities, laboratories, training, communications, and commodities, all of which you as health commissioners are taking full advantage of today to deal with other health issues as well. Just in the past 2 years, with the help of you, all of the health commissioners and your governors, the PEPFAR program has placed 500,000 Nigerians on life-saving treatment. This is inching Nigeria closer and closer to epidemic control, which is something that I never thought I would see in my lifetime, having started my Foreign Service career here in Nigeria 20 years ago. Many of the health commissioners here that either the ambassador, our Consul General in Lagos, or I have met during our high-level advocacy have helped us to get states commits to fill in key gaps in our programming. To make this truly a partnership, this includes procuring rapid test kits, removing user fees for people seeking treatment for HIV, ensuring that every Nigerian has access to HIV testing, and also removing stigma when it comes to this disease. Your political commitment, and that by your governor, and your ability to deliver these life-saving measures combine to ensure that together we continue to close in the gap to epidemic control. And something that my colleague Mark Giambroni will talk about shortly is that that's now within our grasp within 18 months. And I don't think people realize how much work all of you have done to make that happen, and that will be the next success story in Nigeria. So everybody gets a round of applause. So now I'm going to unfortunately call out my colleagues from the mission, who you'll all want to be interacting with, and that includes our U.S. Centers for Disease Control, USAID, and our Walter Reed Army Institute for Research. I have a whole table full of them right there, so that's your target of opportunity. You probably know most of them already, but their teams combined and partnered with your teams have led to the success story that we call PEPFAR in Nigeria. Not only that, the eradication of wild polio, helping support vaccination efforts and deal with other infectious diseases. The U.S. has really been a partner and remains a partner at both the national and state level. So I hope that they have a lot of good conversations with you today. And they've all been very instrumental in helping with the COVID-19 response, and the investments that we've made in the health sector over the 20 years were the backbone of the response. So on behalf of the U.S. government, I just need to say thank you, thank you, thank you for all of your assistance to us in helping improve the lives of Nigerians. Thank you.
Health is the foundation of a more productive, peaceful, and prosperous society. And this is why support for the primary health sector has been and remains the focus of Canada's development partnerships in Nigeria for many years now. But we also believe that for this foundation to be solid, health services need to be inclusive and responsive to the needs of all, particularly women and girls. Of course, and if I've learned anything from my short 2 years in Nigeria, it's that each state is different with different needs, different resources, and different ways of working. But I know we can agree that there is much knowledge and experience and lessons to share across state borders as part of our collective effort to ensure that all Nigerians have access to basic primary health care. And so it's great to be here today to do just that. Thank you very much, and I wish everyone a productive 2 days.
I would like to congratulate the Health Commissioners Forum for putting this very important event together. I believe in the potency and efficacy of networks. People, especially professionals, working together for the common good of the community. For me, this is what this is about. Bringing together Honorable Commissioners for Health, the Health Secretary, Federal Capital Territory, and a number of other players in the sector. I mean, especially those working in the health sector to discuss contemporary issues in the sector and by extension our country. As you all well know, the Nigerian Governors Forum is a similar organization, and the Secretariat services the forum. The thrust of its operational strategy is anchored on collaborative action and pair learning. The NGF Secretariat is the technical and administrative arm of the forum. It operates as a non-partisan policy hub and one-stop resource center across the key sectors crucial to our national development. As custodian of records for the forum, the Nigerian Governors Forum Secretariat maintains a rich repository of resources. I hereby invite you all to visit the NGF Secretariat to assess these resources, and the Nigerian Governors Forum Library is also available to receive materials from everybody. The Secretariat has a pool of experts in health, agriculture, the economy, education, security, etc., who work to align national priorities with activities at the sub-national level. This is usually guided by a strategic plan. We have had 4 strategic plans since inception. For instance, in our recent plan, our broad priorities in the health sector include the acceleration of the attainment of universal health coverage, improving nutrition, especially for women and under 5 children, strengthening routine immunization, and the domestication of the National Action Plan on Health Security. Over the years, the NGF Secretariat has maintained a healthy relationship with the national and state MDAs as well as partners. The Honorable Commissioners for Health are central to this engagement, which is exactly why the Nigerian Governors Forum Secretariat is excited to be here today to be part of this. At our last meeting, the governors met a couple of days ago. I brought the communique for that last meeting. There were 8 resolutions, it will interest you. Out of the 8 resolutions, I just looked at this morning, 4 of them relate to health. That tells you, yeah, it relates to health. So this has been a permanent part of our agenda in the past 14 months. So I want to let all the commissioners know that we're in this with you, and you have our support, complete support at the Secretariat level, and the governors too, I can assure you, are on board. We have a very active health desk headed by one of your colleagues, Dr. Ahmad. He's a representative at the steering committee. There's a technical arm, and he manages and works closely with the Secretary to Government of the Federation, and regularly briefs governors at our meetings. So, by way of conclusion, I want to especially thank all the federal MDAs and development partners for your support. We look forward to the resolutions at the end of this meeting, and be assured that they will certainly be communicated to all the governors. Again, for development partners, it's important you understand that the college of officials gathered here today are the closest people to our governors. So it's important to establish that relationship with every one of them. Pretty important personalities. They play a major role, and I'm happy you really recognize that. There are other players, but it's important you connect with this group to achieve your health objectives at the state level. Thank you, Mr. Chairman.
Thank you very much.
Very important forum, meeting of the Forum of the Honorable Commissioners of Health in Nigeria. The theme of the meeting, which has to do with building stronger health system through collaborative and strategic partnership, would not have come at a better time than because of the fact that we are in the middle of COVID pandemic. And if there wasn't any collaboration and strategic partnership, the COVID pandemic would have has caught Nigeria unawares. But through the effort of the partnership and collaboration under the leadership, able leadership of the Secretary to the Government of the Federation, we have been able to respond appropriately to the pandemic. I wish to congratulate the SGF on his birthday and the effort that he has done in that regard. And I also wish to congratulate my honorable ministers and all the actors that have played a very significant role in the process of containment of this pandemic. Collaboration and strategic partnership is very, very critical to the attainment of the goals of the health sector, especially in a country where a federalism health system is being implemented with 3 tiers, with involvement of many partners and donors. Health sector wouldn't have worked if there is no effective collaboration. So the theme of this meeting is very apt for the healthcare delivery system, and for the healthcare delivery system to be able to respond to the high infant mortality, high maternal mortality, and other high indices that is bedeviling the country. The Honorable Commissioners of Health are very critical to the success of that, in the sense that they occupy the middle space in the arrangement of the healthcare, where you have a federal at the policy level, local government at the implementation level, and the commissioners sitting at the middle. So they are acting as a bridge to the policy making as well as the implementation. So if you take the bridge out, then the whole system will collapse. That underscores the importance of the honorable commissioners in the scheme of affairs of the health sector. And we all acknowledge the vital role the commissioners have played during the COVID pandemics and during the effort to strengthen the healthcare delivery system. From the National Health Insurance Scheme, we have been, in the last 2 years, we have been stepping up reform under our 3-point rebranding agenda to ensure that we have a stronger health system through collaboration with the states and other actors. It is within the context of the reform that health insurance under one roof has been created. It is a platform whereby the National Health Insurance Scheme and all other actors in the healthcare delivery system are working together to ensure attainment of universal health coverage. NHIs have defined the reform of, they have defined the transformation agenda in the areas of total automation of the system. Federal Executive Council has approved our automation process, and infrastructure is fast being built. And we are also working on other initiatives like branding of drugs, like development of a framework that will ensure every Nigerian is not left behind in the health insurance space. And it is important to say that one of the key issues that we are working towards in the healthcare is in the area of making a mandatory mandatory social health insurance for all Nigerians. This is number one health level next agenda of President Muhammadu Buhari, and we crave the indulgence of commissioners and every partner to support towards attainment of this mandatory social health insurance scheme. And I want to especially appeal to the Secretary, to the government, to help us to ensure that the bill, which has been passed and concurred by the National Assembly and is awaiting the assent of Mr. President, is expedited so that every Nigerian can now have access to financial access to healthcare delivery services. I wish to, at this juncture, reaffirm the NHIS support and loyalty to the honorable commissioners, and I pray to Almighty God that you will have a hitch-free meetings, and the proceedings of the meetings, NHIS will be interested so that they can respond to whatever it is within its own purview. Thank you, and God bless all of you.
Thank you, sir.
To curtail the pandemic. It is heartwarming to note that this meeting is not only an engagement between federal ministries, departments and agencies and honorable ministers of health, but also with development partners working in the health sector. at the subnational level. This gathering is essentially an experience sharing forum where members come together to learn from one another on topical issues, share best practices, resolve challenges, and suggest innovative actions that will accelerate the attainment of universal health coverage in each of the 36 states and the FCT for better health outcomes. As the ministry charged with the responsibility of coordinating donor agencies and development partners working in different sectors of the economy in the country, I'm happy to be at this meeting as it provides a great opportunity to hear directly from actors the impact of the interventions by development partners at subnational levels, issues around the implementation of partners' activities and the distribution of development partners working in the various states in the country. I therefore urge all our partners to take this opportunity to present key actions expected to be addressed by the Honorable State Commissioners, particularly the Commissioners of Health, to ensure the success of the partnership. Our ministry will be happy to support states to enable them benefit maximally from the donor agencies while improving on the redistribution of the partners across the country to fill the gap. The outcome of this engagement will be useful to the ministry, especially for future engagements with donor agencies and developmental partners. Distinguished ladies and gentlemen, I would like to raise two important issues which should be reflected upon by the Honorable Commissioners of Health and the development partners. I would like to task the Honorable Commissioners of Health Forum to work out modalities on how the state ministries of health will work collaboratively with their respective ministries of budget and economic planning to strengthen a system for effective coordination of the activities of the partners to promote synergy, avoid duplication, and ensure efficiency and accountability. Secondly, I will task the meeting to look at the mapping of partners across the 36 states and come up with mechanisms to ensure equitable distribution of partners across the country. We urge all partners and international non-governmental organizations to sign cooperative agreements with federal government of Nigeria, represented by our ministry. We will take appropriate steps and measures to approve new ones in order to ensure compliance to Nigerian Official Development Assistance, ODA, towards creating an enabling environment for you to carry out your mandate effectively and efficiently without any hindrance. In conclusion, I will, on behalf of the ministry, acknowledge the continuous support and untiring efforts of the various non-government organizations, international non-government organizations, and development partners working across the country. Distinguished participants, once again, I welcome you to this important event and wish you all very successful deliberations. I thank you for your attention and God bless.
Need to commend people when they do well so that that person can do more. And I'm sure he will do more. I cannot stop there. Kathleen, thank you very much. I've known her forever. Through her, and of course, the United States government did so much for us then, particularly the Lagos State House of Assembly, because we were then just coming out of the military era. That was in 1999. I was speaker in Lagos, and The US government arranged so many capacity building programs for us. And if the Lagos State House of Assembly is doing well, it's because of the grounding and the partnership, the collaboration we had through Kathleen, representing the US government in those days then. And of course, like she's been in Nigeria, at least she's more of a Nigerian than American, I can say that. The DGNGF, thank you very much. Others, of course, Professor Sambo, Executive Secretary of NHIS, the Commissioners, Health Commissioners Forum, and through the chairman of the forum, Beta, at least I'm here now, because she was on my neck, and I told her I would be here, so I'm here. Thank you very much for inviting me. Now, I don't want to, I have a speech here, but then building a stronger health system in Nigeria through collaboration and strategic partnership. Let me just say a bit before my speech. You see, right from my days in the House of Assembly, we always talk of separation of powers between the three arms, particularly the legislature and the executive, but the three arms of government. But then, I always say that separation of powers within the ambit of the constitutionally assigned roles. But for good governance, you need collaboration. You need coordination. You need cooperation. You need cooperation. You need cordiality. And it's the same way in life. Nobody does it alone. And the collaboration we are talking about in this particular instance is both vertical and horizontal. The MDAs, as they exist at the federal level, even the MDAs at the state level, that collaboration, the vertical one, collaboration within the federal government, the state government, even the local government, and down to the communities. Because the concept of universal health care coverage, oftentimes we focus attention on treatment, which probably is the least important of the pillars. That's why the first pillar is disease prevention. And as we always say, prevention is better than cure. Disease prevention, health promotion, then you come to treatment, and then you go to the issue of palliative care. Even before palliative care, you still have the issue of managing effects that arise even from treatment, one way or the other. So we should not focus our attention on treatment. And in all this, having at the back of our mind the goal or the goals of treatment or the goals of universal health care in terms of availability of health care, accessibility, it must be accessible, it must be cheap. And having in mind, when you say universal, particularly the vulnerable is for all, or particularly the vulnerable group, women, children, the physically challenged, the poor. So we must always put this, we must hold this right there. so that we don't miss this issue of what it entails. So having said that, distinguished ladies and gentlemen, I'm aware that this forum aims at fostering stronger relationship, not just among the 36 states and the federal capital territory health systems, but as well as the national health system development. And this event is crucial at this time, particularly as we are in the middle of a pandemic, with a view to building back better a resilient system that will assure security, health security for all. At the Federal Ministry of Health, our goal is to ensure that we provide appropriate stewardship and collaboration to keep Nigeria on track towards attaining universal health coverage. And to achieve this, we are very mindful of the financial investment required. The constricting fiscal space in Nigeria and the current goal on official development assistance, which has continued to dwindle. You heard Olumide say it, that there is donor fatigue. That is the truth. All over the place, it's difficult now to get free funds. We are currently working with the Finance Ministry to explore strategies on how to galvanize additional domestic resources for financing health through pro-health taxes. We will be communicating to you on how to move forward with these interventions as they crystallize. Additionally, there are current plans to institute a framework for financial sustainability for HIV, tuberculosis, malaria, and the entire health system. All these are geared towards accelerating universal healthcare coverage for every Nigerian. The leadership of the Federal Ministry of Health will continue to provide the required stewardship that will drive tailored policy direction and environment for interventions and instruments that will guarantee sustainable financing for health, as well as a strengthened system for adequate mix and distribution of healthcare workers and essential services. We are expediting actions and strategies to address the current mass exodus of our skilled health workers. We are mindful of the ongoing National Association of Resident Doctors, industrial action, and massive loss to the people and government resulting therefrom. We will continue to appeal to all concerned parties to embrace dialogue and positive negotiations for the greater good of our people. The National Health Act 2014, which is our legal framework for operating, funding, and coordinating our national health system, will continue to guide the development of our strategies for institutionalizing a resilient system. We remain committed to working well and more closely in a more strategic manner with the Commissioners of Health in all the states and the Health Secretary of the Federal Capital Territory, our private sector partners and development partners to deliver on our health mandate, especially in these trying times. Let me also appeal for your continued support. We need each other at this point in time more than ever before. hasten to add that where there are issues that need further clarity, and there will be, the Forum of the Commissioners of Health should not hesitate to reach out to the Health Partners Coordinating Committee domiciled in the Department of Health Planning, Research and Statistics to work out mechanisms for involving the Forum in the meetings of the committee. Now, let me pause and say further that we cannot discountenance the reality of our governance structure as a country. Some people have described our structure as cooperative federalism, as opposed to what some people call true federalism, quote and unquote. Because when you say true federalism, that presupposes that you also have false federalism. But I'm not aware of any false federalism. But some describe us as cooperative because a lot of things that people ordinarily believe should be taken up by the states, the federal is also coming in to take charge. But the truth is this, if it must be told. Our Constitution, if you look at the lists, exclusive lists, legislative list, and the concurrent list, you will not even find health as an item. And what that says is that health is in the residual list. And if it's in the residual list, it is a function of the state. That is the reality. But then we will not stretch, and we cannot even afford to stretch that too far in the spirit of this cooperative thing. But I'm saying that as much as possible, the states must also take charge, because the basic things, they are within the realm of the state. If you're talking of health education, nutrition, diarrhea diseases, malaria. What we were told in medical school is that common things occur commonly. Now those are things that can be taken charge of at the level of the primary care. That's the truth. And when we have functional systems at the primary care level, then we will not clog the activities that are ordinarily meant for the secondary level and tertiary level of care. So, I want to urge our colleagues at the state, and I'm happy that the DG of the Governors Forum is there with us, while we emphasize the need for this collaboration and partnership. We should still be seen to be doing the basic things that we should do, particularly at the state level. So I want to sincerely thank and appreciate all the health commissioners for the great work you are doing, particularly at this period. It's really tasking, there's no doubt about that. But you have all done well, I must say. And thank you for your contribution to our national effort. I assure you that the administration of President Muhammadu Buhari remains committed to making our health sector great again, and will continue to support health programs and interventions that contribute to the socio-economic development of our dear country. I cannot but reiterate that we should not let our attention be strictly focused to treatment. Let's recognize those critical pillars that I mentioned, that is disease prevention, health promotion, treatment, rehabilitation, and then palliative care. And of course, making all this available, accessible, cheap, or affordable, and focusing on the vulnerable groups, the aged, children, women, the physically challenged, and the poor, which even the Bible says, the poor we shall always have around us. So it's on this note that I want to thank you very much for your kind attention and wish you fruitful interactions throughout this meeting. Thank you very much. You also have false federalism. I'm not aware of any false federalism, but some describe us as cooperative because a lot of things that people ordinarily believe should be taken up by the states, the federal is also coming in to take charge. But the truth is this, if it must be told. Our Constitution, if you look at the lists, exclusive lists, legislative lists, and the concurrent lists, you will not even find health as an item. And what that says is that health is in the residual list. And if it's in the residual list, it is a function of the state. That is the reality. But then we will not stretch, and we cannot even afford to stretch that too far in the spirit of this cooperative thing. But I'm saying that as much as possible, the states must also take charge because the basic things, they are within the realm of the state. If you're talking of health education, nutrition, diarrhea diseases, malaria. What we were told in medical school is that common things occur commonly. Now those are things that can be taken charge of at the level of the primary care. That's the truth. And when we have functional systems at the primary care level, then we will not clog the activities that are ordinarily meant for the secondary level and tertiary level of care. So, I want to urge our colleagues at the state, and I'm happy that the DG of the Governors Forum is there with us, while we emphasize the need for this collaboration and partnership, we should still be seen to be doing the basic things that we should do, particularly at the state level. So I want to sincerely thank and appreciate all the health commissioners for the great work you are doing, particularly at this period. It's really tasking, there's no doubt about that. But you have all done well, I must say. And thank you for your contribution to our national effort. I assure you that the administration of President Muhammadu Buhari remains committed to making our health sector great again, and will continue to support health programs and interventions that contribute to the socio-economic development of our dear country. I cannot but reiterate that we should not let our attention be strictly focused to treatment. Let's recognize those critical pillars that I mentioned, that is disease prevention, health promotion, treatment, rehabilitation, and then palliative care. And of course, making all this available, accessible, cheap, or affordable, and focusing on the vulnerable groups, the aged, children, women, the physically challenged, and the poor, which even the Bible says the poor we shall always have around us. So it's on this note that I want to thank you very much for your kind attention and wish you fruitful interactions throughout this meeting. Thank you very much.
Mr. Boss Mustafa, SGF of the Federation. You're welcome, sir.
Thank you. For heads of government agencies and parastatals, development partners, international and national, members of the private sector, chairperson and members of the Nigerian Health Commissioners Forum, distinguished ladies and gentlemen, invited guests, gentlemen of the press. Let me start by expressing my delight and pleasure to be part of this opening session of this very historic meeting involving the Federal Ministry of Health, federal departments and agencies, development partners, and health commissioners from all the states of the Federation. But before I go any further, let me deliver the warm felicitation of His Excellency Muhammad Buhari, President of the Federal Republic of Nigeria, who continues to champion the prioritization of health issues on the national agenda, and he is eagerly awaiting the outcome of this meeting and to express his appreciation for the diligence and the hard work exhibited by the State Commissioners for Health as representatives of the health sector in our national constituencies. And also to bring warm greetings from one of you who worked very, very assiduously and tirelessly in the course of this response. As I was heading to this meeting, I got a call from Dr. Chukwe, the now Assistant Director General of the World Health Organization. He's asked me to extend his inability to be at this meeting because he is currently in Geneva, farming up his new course of responsibility. And I think this is about the best season in the medical sector or in the health sector. For the world to acknowledge the fact that we have put up a very effective and robust national response through the collaborative effort of the government, the development partners, the business and private community, and the subnational entities. And to, at this moment, elevate one of us to start a new hope in pandemic and intelligence, epidemic control in the headquarters of the WHO. I think it's a thing of great joy. Out of the abundance of negative news, at least we have a spotlight that brightens the horizon for us as a nation. I think Chikwe's representation there will be quite befitting, but he's also asked me to assure you that even from where he will be operating from, he will continue his collaboration with the national response, and by extension, with those of you that are heading the health sector in your various states. I would similarly like to acknowledge the Nigerian Governors Forum for supporting this important meeting that has brought together key actors in the health sector at the national and subnational levels, to discuss contemporary issues impacting the health sector in our country. This meeting could not have come at a better time than now, because Nigeria and the global community remain locked in a battle with the COVID-19 pandemic and other emerging issues in the health sector. The health of the citizens, as you know, is the health of the nation. This statement underscores the importance or the important relationship between the health and other sectors, including the socio-economic development and security of our nation. There is no doubt that the COVID-19 pandemic remains the most defining global health crisis of our time. The pandemic has not only stretched countries' health resources globally, but has also caused unimaginable havoc to the social, political, and economic development of all countries. As a matter of fact, the COVID-19 pandemic, came with a storm and exposed the weaknesses of all our systems, exposed the weaknesses in our economic system, exposed the weaknesses even in our governance structure, because I saw the well-established democracies, which have existed for over 200 years, locked in disagreements as to who could impose the mandatory use of masks in public places. Is it the responsibility of a mayor or that of the state governor? These are democracies that have existed for over 200 years. But COVID-19 exposed the weaknesses in all the systems. It exposed the fact that we are not inclusive in even our policies, and exposed immense hardship that came to the underprivileged and those that live in mostly rural communities. In Nigeria, we've not been spared. And I say that looking at our figures, Nigeria still, to date, recorded 192,000 infections plus, out of which 178,000 plus discharge, and unfortunately with a fatality rate, of deaths, 2,469 fatalities. But you see, the story would have been different except for the collaboration we received from the different states in the country, the hands of fellowship and friendship that was extended through our development partners, and the robust engagement the government pursued with the private sector. I think our national response in Nigeria, if it is not done anything to me and my psyche, it has exposed that government can still work and work efficiently and effectively if it can engage its private institutions and get them to key into government programs. Although the number of cases came down a few months back, the number has once again begun to rise, and we are currently witnessing a third wave of the pandemic, which is largely driven by the Delta variant of the virus and fueled by the non-adherence to public health measures by the general public. Well, one good thing about Nigerians is that they can be extremely difficult to manage. But the truth about it is that COVID-19 has also exposed that even those societies that we thought were civil have become very recalcitrant with management of COVID-19 and their resistance even to the public health measures that have been put in place by their government. So I think it's a human nature. There's nothing typical about Nigerians resisting management. But I believe if we can have the collective support of our people and the modest efforts that have been put in place through the national response that we had couched, involving the states, at every level through the Nigerian Governors Forum, the routine meetings and dialogue we've been having. I believe that we will be able to substantially tame the tide of even the third wave that we're experiencing in the country. The Presidential Steering Committee on COVID-19, the multi-sectoral body driving the national response, has clearly underpinned the importance of collaboration at all levels to the success of our national response. This is signposted by dialogue, enforcement, investment, risk communication, and effective surveillance by all stakeholders. It is in this regard that I urge you as commissioners to provide effective leadership at state level. I know the constraints of commissioners because working with your bosses, oftentimes through different meetings, I know the challenges you experience and the fact that probably the resourcing at the state levels are limited. And that explains why sometimes we pass protocols, we ask for certain things to be done in the states. And the feedback we get is that we are constrained. But I believe that we need to do everything to make sure that even at the state level, as we're preparing for our 2022 budget, that we resource the provision of health infrastructure and do something drastic and dramatic, because this is the best season to be able to do it. I've often shared that at the Presidential Steering Committee meetings. And I've personally spoken to the Honorable Minister of Health and his colleague, the Minister of State. And I've said it openly, that this is the best time for us as a country to recalibrate our health infrastructure. After COVID-19, you won't get the kind of attention you are getting now. So seize the opportunity that this moment provides for you to do everything you can to ensure that post-COVID-19 we'll have a better medical infrastructure in place. The federal government, in its determination to ensure that the health sector is strengthened, has continued to provide financial, technical, and infrastructure support to subnational entities. At the peak of the pandemic, with the exception of Lagos and Kano states, who are big in terms of their population, other states and the FCT received at least 1 billion naira each as federal government's direct financial contribution to these states to be able to put in place a very effective and efficient robust, collaborative response to COVID-19 management. In the area of infrastructure, when we started, I think the Lagos State Commissioner of Health probably can correct me here. Nationwide, I think we had just about 2 or 3 molecular laboratories that could do PCR tests. Just 2 or 3, the entire nation with a population of about 200 million people. But today, at least we have delivered in each state of the Federation not less than 1, either through government intervention or development partner intervention, or through private engagement, many other PCR laboratories. Through COVID, each state was to receive a 30-bed ICU for critical care. I think it's an ongoing exercise. We hope that by the time it's all said and done, all these facilities will be put in place. And just recently, the President approved the construction of at least 1 oxygen plant in each state of the Federation, in addition to those that are already in place. And I understand Gavi 2 or Global Fund have also made provisions for the rehabilitation of the broken down ones and also the provision of new ones. This is all in an attempt, having seen what happened to India, our major source of supply for vaccines, shutting down because of the third wave experience and the inadequate supply of oxygen. We decided that as a government, we needed to in place at least a minimum standard of provision for oxygen in case we ever get there. For the national response to be effective, therefore, all stakeholders, including the national and subnational entities, must play their roles in a complementary manner because the lives of our citizens remain very precious and their safety is our responsibility. The race against COVID-19 is a marathon and we should never become weary. This appeal goes to our international development partners. This is not the right time for donor fatigue to set in. We need all to be on board. We need all the assistance and the extension of the goodwill and benevolence that we have enjoyed to continue to flow. Research and science have played their parts in taking the battle against the virus to the vaccine stage. Global vaccine nationalism is still raging, but we have succeeded in accessing millions of doses of vaccines through partnership and also diplomatic efforts. The acquisition of sufficient doses that will enable us vaccinate 70% of our population is in progress. That is all in an attempt to get to the point of herd immunity. And only recently, the second round of vaccination was launched. You should, in the course of this meeting, honorable commissioners and members that will be participating in this discussion, deliberate on the challenges caused by vaccine hesitancy all over the country, either as a result of misinformation or disinformation. We have to deal with that because that is a major militant against wider coverage for the vaccinations. It is expected that you will come with policy alternatives as solutions. Let me state, however, that the federal government shall very shortly unveil its decision on mandatory vaccination for every employee in its service. We are working on a protocol. We are working on a protocol that will make vaccine mandatory for every employee in the public service. We're trying to hedge up the supply of vaccines and also fine-tune the policy. It is important that we lead by example. When the president and the vice president and those that are in government position began to take the vaccination, it became easier for the ordinary citizens to follow suit. So that will be put in place very, very soon as we increase the supply of vaccines. I'm happy to note that this meeting will be discussing broader health issues such as one, the basic health care provision fund, two, strengthening primary health care in our various constituencies. This is an area where I believe that you need to put your searchlight. We have about, I think, not less than about 8,000 or so constituencies or wards in the country. And I believe that in each of these wards, some even have 2, 3 primary healthcare centers. But how operational are those primary healthcare centers? And like Senator Mamura rightly said, we need to decouple these things and make them more effective and user-friendly so that not everything gets to the general hospital, which is the primary responsibility of the state governments. The primary health care are the responsibilities of the local governments, while the tertiary health institutions are the responsibilities of the federal government. But in a way, it has not worked as it ought to. And I think this meeting should come up with solutions and resolutions directed at that, on how to effectively utilize most of these primary healthcare facilities that have been built at great cost to either the states or the federal, and not being put to optimal use. You also be dealing with HIV/AIDS control with its multi-sectoral consequences. And fourthly, universal health coverage and health insurance, as well as various high-impact interventions being implemented either directly or with our development partners. It is my expectation that all those identified challenges hindering smooth implementation of partnership support at the subnational level will be outlined and measures to address them articulated and agreed upon by the end of this meeting. The federal government also expects that you will find time as policy and decision makers to address the root causes of incessant labor crisis in the health sector. This is extremely important. We are now in autopilot as far as crisis in the health sector is concerned. We've been navigating, trying to resolve the one with the National Association of Resident Doctors. The Nigerian Medical Association has served a notice. I have received a threat from Jehesu. So in the final analysis, the whole system will come to a total stagnation if that happens. But you have primary responsibilities as commissioners in your states to deal with these issues at the subnational level. Federal government has got a responsibility of policy formulation and direction, but most of the implementations, most of these hospitals are in the states, though some part owned by the federal government, but most of the institutions are owned by the states. And these doctors serve in these facilities. But I believe truly that something drastic and revolutionary ought to happen in the health sector for us to get out of this quagmire. I don't know how it will happen, but we will be depending on you as the operators at the state level to come up with policies and resolutions that will help government take a decision in this regard. Before I conclude my address, I will continue to make this passionate appeal like I've made in the past, that in the midst of a pandemic, strike action is not helpful to anybody, whatever the reason for the strike action is. In the midst of a pandemic, because our primary responsibility is to try as much as possible as a government and as a people to bring succor to our people, not to bring misery to our people. I believe as you return back to your states at the conclusion of this exercise, you will lend your voice to making a passionate appeal that dialogue and meetings and engagements is the best way out of the present problem. I would like to use this opportunity to appreciate the numerous support received through our development partners and organizations such as the COVID, Aliko Dangote Foundation, the Bill and Melinda Gates Foundation, Gavi, USAID, FCDO, EU, World Bank, GAC, JICA, UNICEF, and other United Nations agencies. I want to assure you that we do not take your partnership for granted. We are mindful of the fact that you represent international organizations and some of you represent your nations. And we believe that this friendship is supposed to be nourished, cherished, and sustained. Because individually we will not be able to solve the problems of the world, but I think collectively we will be able to ameliorate and reduce the heightened problems of the world. I would also like to acknowledge the Federal Ministries of Health and that of Finance, Budget and National Planning for effectively coordinating partner activities across the country. Before I end my remarks, let me express my personal joy and gratitude to the chairman and members of this forum, and all of you attending today for being extremely generous with your love and share of fellowship as exhibited when you, in advance, wish me a happy 65th birthday. On Saturday, the 4th of September, I will turn 65. I'm still counting more, and I would just say that truly God has been gracious to me. Yes, in 65 years, I have enjoyed very good health. I probably spent a day in the 65 years for malaria in a hospital, just a single day. So God has truly been gracious to me. I do not take it for granted, and I thank you so much. Ladies and gentlemen, it is now my singular honor and privilege to declare this meeting of critical stakeholders in the health sector open, and I wish you a fruitful deliberation. God bless the Federal Republic of Nigeria. Thank you.
Thank you very much, SGF.